This stuck out at me quite striking. In her own words, she says, worked for many years at St. Paul's Hospital. So don't know how many that is, but it's probably more than 2, as a critical care nurse. She completed her communications degree at SFU. And while working public relations at BC Children's Hospital, learned of the Healthy Heart program. And that's where we have the prevention clinic. We have a cardiac rehab program there, run clinical trials. There's a basic science lab. It's where the metabolic syndrome clinic is centered. And upon instantly learning of that, she moved to St. Paul's and started working in the cardiac rehab program, and then started to truly appreciate the value of prevention and health promotion. And it seems a common trend that when you're working in an area of disease that you want to actually go further and start to prevent it before you see people coming to you with the disease. So has worked in the past 3 years with Dr. Francis in the Healthy Heart Program Prevention Clinic, where smoking cessation is her prime focus and the topic of her talk tonight. So thank you.
Stopping smoking. Can everybody hear me? Okay. Bit louder? Okay. Stopping smoking can be a tough challenge, and so our focus here tonight will be on strategies for smoking cessation. Smoking is the single most significant cause of preventable death and illness in Canada. 50% of all smokers die from a smoking-related illness, and most of these lose about 22 years of life, the 50% that are dying under the age of 70. The other 50% of smokers that are dying after age 70 lose an average of 7 to 8 years of life. Smoking is a major risk factor for cardiovascular disease. Looking at the prevalence rates of smoking across Canada, you can see that BC is lowest at 15%, and the national average is about 18%. In all provinces, it's the 20 to 24-year age group that has the highest rates of smoking. So why do people smoke? Well, the reason that people continue to smoke is nicotine. It's the addictive ingredient mixed in with the tobacco. And nicotine increases the levels of dopamine in the reward circuits of the brain. And dopamine is a neurotransmitter. It acts on the brain to increase the levels of alertness, mood, it's calming, and it also decreases appetite. And it's the dopamine decrease between cigarettes that leads to the withdrawal symptoms of irritability and stress. Where the dopamine reward circuits are located in the mid part of the brain, it's the frontal part of the brain that is the rational thinking part, and this is why smokers often have this internal tug-of-war where they want that cigarette, but they know it isn't a good health choice. It's because of the two different parts of the brain involved. When a person is smoking, the lit cigarette produces carbon monoxide. A person inhales that through their lungs. It diffuses into the bloodstream, and the carbon monoxide binds to the hemoglobin on the red blood cell. And it always wins out over the oxygen in competition. It binds successfully to the hemoglobin, and then, therefore, a smoker has all this carbon monoxide that circulates throughout their bloodstream and less oxygen. So it's the carbon monoxide as well as the toxic chemicals mixed in with the tobacco that have the damaging effect on the artery walls. And as Dr. Francis mentioned earlier, smoking also increases the heart rate, the blood pressure, increased chance formation of blood clots, and inflammation of the artery walls, and it lowers the good cholesterol. When a person stops smoking, they go through the stages of change. And the first one is pre-contemplation, and this is where a person isn't thinking about stopping at all. They may or may not know that smoking is harmful for their health, but it doesn't concern them. And the next step then is contemplation. And this is where a person starts to weigh out the pros versus the cons of smoking. And an important part of this step is their level of confidence in being able to stop smoking and their conviction about the belief of the value of stopping smoking for them. So both confidence and conviction have to be at a moderate level to a high level in order for a person to move on to the next phase, which is preparation to stop smoking. And this is doing the things that we're going to talk about, the steps that you need to take to help to be able to stop better. And then the action phase is about, can go on for about 6 months, and this is where people are actively stopping smoking. They may be taking medication for 3 months, possibly 6 months, to help stop. And then finally the maintenance phase, doing what it takes to stay smoke-free. So in preparation, it's very important to develop a quit plan. Take a look at the calendar. See what you have coming up. It's important to pick a quit date. Excuse me. And you may want to wait for a couple months until you start vacation. You know, if you have more time, then you're away from your usual life demands, your triggers. It may be worth it to wait a couple of extra months before stopping. Also, anticipate your fears. Are you worried about withdrawal symptoms, possibly being irritable, cranky to be around? Are you worried about failing, possibly weight gain? Enjoyment of tobacco. Maybe it's something you really enjoy and, you'll miss it. Also, the cost of pharmaceutical treatment. Maybe last time you stopped smoking, you had a bout of depression. Lack of support. And, do you live in a household with other smokers? Those can all be real fears that people, worry about before actually stopping. Important to develop your lifestyle triggers. This can be anything from that morning cup of coffee to alcohol to possibly spending your lunch break. Maybe the people you work with, after lunch you go outside and have a cigarette. So it isn't just the smoking, but it's also the social part that you're thinking about missing. And important to develop coping skills to help manage these trigger situations. And you need to anticipate them, and for now, avoiding temptation. And later on, after you've stopped smoking, you can reintroduce the trigger situations gradually. And find strategies that reduce negative moods and stress and help improve the quality of life. Some people find it very helpful to cut down the number of cigarettes they smoke before their quit date. Other people are not quite ready to quit, but they may want to cut down, see if they can cut their cigarettes down from, for example, 20 a day to 10 a day. And if you keep a journal for 3 or 4 days beforehand and write down the time of day, how many cigarettes you're having, what you're doing at the time that you're lighting up, and take a look at why you're lighting up. Are you craving the nicotine? Is it habit? That's what you do that time of day. Or is it boredom? It's just something you're doing. And you may want to smoke only half of the cigarette and put it out. Delay the time between each cigarette. Possibly make your car and your home a smoke-free zone so that it's not quite as convenient to light up. And buy a brand of cigarettes that you dislike. Enlist the help of others, and possibly keep your hands busy and occupied. Now, choosing a pharmaceutical treatment has been shown to double your quit rate at 1 year compared to placebo. And the goal of pharmaceutical treatment is to prevent and treat nicotine withdrawal symptoms. There's 3 main options. There's nicotine replacement therapy, or NRT, varenicline, the trade name is Champix, and bupropion slow release, the trade name being Zyban. So nicotine replacement therapy is giving you the nicotine, but not the toxic substances that you get with the cigarettes. And so you have the nicotine to slowly fill the nicotine receptors, and this eliminates the withdrawal symptoms and the cravings. And as a result, you have less desire to smoke and less pleasure if you are smoking. And nicotine replacement doubles the quit rates at 1 year compared to placebo, and it can be used to reduce smoking as well as stop. So that's something that's changed in the last 5 years. It used to be that if you were using nicotine replacement, you couldn't smoke, but now it's acceptable that you can do that, and you can certainly use it to cut down. So nicotine replacement therapy comes in the patch, and that's sort of the main type of therapy because it's released slowly over 24 hours. And it comes in the 21, the 14, and the 7 milligrams. And as far as how much you need, it depends. Each person is a little different. But generally speaking, if you smoke a pack a day or more, you would start with the 21 milligrams. And you can up that with either 7 or a 14 milligram patch until you were at 42 milligrams, double what you started. And if you're smoking about 10 a day, you'd probably start with the 14 milligram patch. Nicotine gum and the lozenge, they both act more quickly, so they give what we call an immediate hit of nicotine, and it peaks in about 20 to 30 minutes. And what's recommended now is if you're using the nicotine replacement, you use the patch and then you supplement with either the gum or the lozenge for the breakthrough cravings. And also there's the nicotine inhaler, and the dosage you're getting depends on how many puffs you're taking and how hard you're drawing on it. And some people really like it. Others find that hand-mouth motion is a little close to the smoking. But there's no time length for using NRT, and it's safer than smoking. So, for example, if you needed to use it for a year, it's not a problem. So is NRT addictive? Well, if you were smoking, the inhaled nicotine reaches the brain in about 7 to 10 seconds. The patch peaks about 2 to 6 hours after you apply it, and the gum and the lozenge are peaking in about 20 to 30 minutes. So we know that addictive potential tends to correlate with the time it takes to reach the peak concentration. So because the nicotine is delivered more slowly and generally in lower doses over the 24 hours than a cigarette, the nicotine replacement is significantly less addictive. Now, varenicline, the trade name being Champix, is a medication that was designed specifically to stop smoking, and it was approved by Health Canada in 2007, and it's on the market pretty well throughout the Western world. And it acts in 2 different ways. The first activity it has is as a partial agonist, and it's binding to the nicotine receptor sites to partially stimulate the dopamine release. And this results in reduced cravings and withdrawal symptoms. And the second activity is as an antagonist, and this is where it blocks the nicotine receptors, and so a person doesn't have the pleasurable effect that they usually get from smoking. Now, listed in the medication warnings are warfarin, theophylline, and insulin. And the studies show that those, Champix doesn't interact with those medications. It's just that when you're on the Champix and you stop smoking, it's the not smoking that interacts with the medications because the smoking changes your metabolism. And so you may need to have your dosage of the insulin, the warfarin, and the theophylline adjusted. Now, bupropion slow release, or Zyban, was a medication originally designed to treat depression, and it's been shown to increase your chances of quitting by about 50%, but it is contraindicated if you have a seizure disorder, an eating disorder, anorexia or bulimia, or if you're taking any of the MAOI antidepressant medications. And with both Champix and Zyban, you start taking them and you pick your target quit date in the second week. So this helps take a bit of pressure off on that target quit date. And the Champix you're taking for about 3 months, and the Zyban sort of 7 weeks to 12 weeks, 3 months. So just looking to compare the continuous abstinence rates at the 1-year mark, Champix is about 26% effective. People who have taken it for 3 months, 26% aren't smoking it a year. With nicotine replacement, also taken for 3 months, it's a little lower at 20%, and Zyban's at 15%, and placebo at 10%. Now, the nicotine replacement there at 20 is a nicotine patch, and some recent studies show that if you're doing the combined therapy, the patch with the gum and the lozenge for breakthrough cravings, you increase that abstinence rate by 50%, so it would be up to 30% then for the NRT. In terms of relapse prevention, to quote Dr. Fred Bass, even a puff can light up the brain's addiction pathway. And relapse is a process related to urges connected to physical withdrawal, habit, and memory. And triggers that set off these urges are related to people, places, things, moods, and stress. So pretty well everything. In summary, the risk of cardiovascular disease returns to the same level as a person who's never smoked after 15 years. And it often takes about 5 or 6 serious quit attempts before being successful. And stopping smoking is the single most important thing a person can do for their health. Thank you.